Welcome to Capitol Report with State Representative David Bly. I'm Mike Howard. Representative, we're at the end of the 2010 legislative session. It's been a long ride, so welcome to come into the studio to talk about what you folks did this year.
Yeah, well, thank you for having me in again. And yes, it was a long and it seemed like a session that wasn't going to end as we got into the closing minutes of it. We did, though, come up with a deal. We had to go into a short special session to actually close the deal, but we were able to do that, and I'm really glad that we were able to, that the leadership was able to negotiate with the governor to come to something that we could accept. I had, kind of my line in the sand, that I wouldn't vote for a bill if it didn't have protections for nursing homes and long-term care facilities, and we were able to avoid cuts to those. I wish we could have given them a little more. I know the hardworking people that work in those facilities, they really need to see some increases, not declining income. So I wish we could have done more, but at least we stopped the cuts that they could have gone there.
Yeah, it was, as folks maybe saw on the news, kind of a busy last couple weeks that kind of really kick-started into gear when the Supreme Court overturned the governor's unallotments. It created a $3 billion hole for you to fix, basically.
The key issue there really was that regardless of the solution, the governor needs to negotiate with the legislature. And he refused to do that, declined to do that, and we're glad that the Supreme Court recognized that, yes, the legislature does have, we are one of the legs of the three-legged stool of solving our governmental problems. And we might have ended up in the same place with the governor with the cuts that he made had we negotiated, but the key issue is he's got to talk with us. It's the solution that we have to come together from. And so I'm really glad that we were able to resolve that. Now, some folks might say, well, the governor got what he wanted. And, in most cases, governors get 90% of what they want unless you're able to override them. And we were in a position where we really couldn't get the votes to do that. The governor was not wanting to compromise at all. And the Republicans, they viewed that their position was to say no to everything, even the governor's plan. They said no to. So we were in a tough place there. But I think getting the early MA into the discussion and signed into law was really an important victory for us.
And what is early MA for folks that are starting to hear about it? I mean, it really is a great deal for Minnesota taxpayers, and it's in state law now.
And it allows us really to solve our GAMC problem, our General Assistance Medical Care. So what it is that it allows for repayment to providers, hospitals, and doctors who take on those patients who really can't afford to pay anything for themselves. They're the sickest and the poorest of the poor. So, and it really is important for our providers, our hospitals. I had a conversation this morning with my own personal doctor, who's a small doc. He has his own office. He's not in a partnership with anybody. Small businessman, essentially. And he said he does occasionally take some of these patients, but he really can't afford. It would put him out of business if he tried to provide service to too many of them. And this simply allows doctors and providers to be able to care for these patients that need the care and can't afford it. So it's a very good program. I hope that the governor opts in to take the $1.4 billion that's out there. It's our own tax dollars. We've paid it in, and Minnesota is, I think, 48th among the states getting a return on the tax dollars that's into the federal government. So this is a way for us to get that money back, and it's really important that the governor follows through with that. I had another conversation with a friend of mine who adopted daughter. She's now adult, but she's deaf and has mental health problems. And she's in a group home, and the cutbacks that they've received have caused her to, not be able to be on her medications as much, and it's causing all kinds of problems to them. And he came with a very sad story. He said, I don't know where we're going to, because the group home probably can't keep my daughter anymore. Where are we going to put her? And so that money, that very money that would come from the federal government would help him. And I'm sure that's just one story among hundreds out there that people need this kind of care. They need this kind of help. And if we don't provide it, they're going to be dire circumstances. And so it's really important.
Well, it's an issue that we'll continue to talk about now that you've put it into state law moving forward. And like you said, it's tax dollars coming back to Minnesota. And I know that you encourage your constituents that have questions about the end of the session or early MA, what passed, what didn't pass. you encourage them to get in touch with you.
Yes, that's right. And we had that also, that education. I've had questions about the education bill that sort of failed at the very end, the last gasp. Again, Republicans said no to what really was a very good, non-controversial bill that would have helped schools. And I had actually 4 bills in that last bill itself that would have helped alternative schools and some other institutions out there. So it was discouraging to see that we couldn't overcome that partisanship that would end up at the very end too.
And I think important with that bill is it passed 66-0 in the Senate, so it really was a bipartisan bill.
And the governor had said he would sign it, so it was unfortunate. I guess they just couldn't let go of that final no. But
there was successes, disappointments, but at the end of the day, a balanced budget and no cuts to nursing homes, no cuts to direct schools, and this early MA. So some real results.
I think we got as much as we could have, considering this is a governor who didn't want to take any revenue at all, and we were able to get something from him. So I think it's important.
Well, thanks for joining us. This has been the last Capitol Report of the 2010 legislative session. We'll see you next time.